Good morning. I'm Cindy. Thank you so much for being here, for your time and attention, and most importantly, for speaking up as a voice for our patients and communities. I'm excited to share my passion and my life's work that has been dedicated to cancer care. I'm a clinical nurse who has spent the last decade specializing in oncology. Throughout this remarkable journey, I've had the privilege of wearing various hats. I've been a staff nurse on an inpatient floor. I've served as a leader in an outpatient infusion center. I've had the honor of working with talented nurses in interventional radiology. And then more recently, I spearheaded a sepsis program at a large health system. I've collaborated with esteemed providers, administrators, and colleagues to deliver quality patient care. But I've also worked with multidisciplinary teams on projects to improve outcomes and inefficiencies throughout my career. These experiences have given me countless opportunities to touch the lives of patients, families, and our larger community in ways that resonate deeply. Each interaction, each challenge has been a stepping stone that has refined my clinical and personal growth. For these lessons, I am genuinely grateful. My professional evolution has led me to a profound realization. I've discovered my purpose and my unwavering commitment to a very specific community, cancer patients and their families. It is a calling that I've embraced wholeheartly. Now I find myself in the extraordinary position of being able to give back. Starting this business has allowed me to help patients and their families during their challenging journey through cancer. This is how the cancer team came into existence, an independent nurse navigation services firm designed to guide and support those enduring cancer. That's my little Olivia. You can't see it too well, but when she was just 4 days old, she was smiling so big like that. As a healthcare provider, my professional background has equipped me with valuable skills and knowledge. However, I'd like to take a moment to share my personal experience that profoundly impacted my perspective on this topic. It all began during a routine postpartum visit after my daughter's birth. Little did I know that a seemingly ordinary appointment would turn into a completely unexpected journey. During the visit, a curious lump behind my ear caught the attention of my OBGYN, prompting further tests. The results revealed a diagnosis: metastatic thyroid cancer. In that moment, a tidal wave of fear and uncertainty took over me. How would I ever find the strength to navigate this? The weight of the responsibility for my daughter's future felt unbearable. But what came after that was hope, reminding me of my worth, my valuable experience, and knowing that I wasn't alone. My loving family and network of supporters who helped me find the resilience within myself. With each passing day, I found the courage to confront the challenges that I was faced with. For the sake of my daughter, I willed to fight, to endure, and keep going. This deeply personal journey shed light on the healthcare landscape from a whole new perspective, inspiring me to address crucial issues head-on. I decided to use my experience as a catalyst for change, to advocate for a healthcare system that would never let another person feel as lonely as I did. It is my mission to share strength, to heal, and to inspire others to fight for a future where cancer is no longer taking the lives of our loved ones. The principle I built our business model is based on this: no person with cancer should ever have to spend more time fighting their way through the cancer care system than fighting their disease. In today's healthcare environment, hospitals often face overwhelming demands and limited resources, making it challenging to offer the attentive and detailed care that a complex cancer diagnosis requires. As advocates, we understand the importance of anticipating patient needs and proactively stepping in to be able to fill the gaps that inevitably exist in care. So what else can we do as advocates? We can work with our health systems to help make the cancer process more efficient and comfortable for patients and their loved ones. We can go beyond providing basic medical treatment. We can better support our patients, families, and communities in healing their journey by simplifying the cancer care system, offering emotional and psychosocial support, and advancing cancer care through research and innovation. Advocates achieve these larger goals in a few ways, and I'll name a few, but there are many more, as we all know. Through comprehensive care coordination, we can work closely with patients to streamline the process, ensuring timely appointments, tests, and procedures, while minimizing unnecessary delays. By serving as the single point of contact, we alleviate the burden on patients and their families, allowing them to focus on their well-being. We can offer personalized support and education. We provide personalized guidance, ensuring that patients have a thorough understanding of their diagnosis, treatment options, and potential side effects. By empowering patients with knowledge, we enable them to actively participate in decision-making, leading to more informed choices regarding their care. We connect them with resources. These may include counseling services, support groups, nutritional guidance. By offering a holistic approach, we strive to enhance the patient's and family's quality of life. We take a collaborative approach. By fostering open lines of communication with their care team, we optimize treatment outcomes and prevent any potential gaps or duplications in care. By working with multidisciplinary care teams instead of against them, we offer patients truly comprehensive and integrative care. And lastly, we empower patients and loved ones. We foster a supportive environment where they can openly express their concerns and fears. We encourage the patients and their families to take an active role in managing their disease, fostering a sense of control and empowerment. So as a nurse, we understand the importance of having a systematic approach to effective problem solving. So the first thing we do is assess the situation. Next, we implement a strategy, and then finally evaluate those outcomes to make sure that our strategies work. If they don't work, then we change the idea and move on. From the very beginning, my team has been dedicated to assessing the cancer landscape thoroughly. We have carefully examined the facts and identified critical gaps in care in the United States. Let's take a look at some eye-opening statistics together. According to the CDC, cancer currently ranks as the second leading cause of death. Who can tell me what the number one cause is? No, it's heart disease. But that was a really good guess. But the interesting thing is the difference between heart disease and cancer, that number of lives that are lost, is only 90,000, which is less than 100,000. This year, there are expected to be 1.9 million cases of new cancer diagnosed just this year in 2023. 600,000 of those are expected to be cancer-related deaths. So, according to this projection, how long do you think it will be before cancer moves up to the number one leading cause of death in the United States? Probably not very long. The American Cancer Society outlines the lifetime risk of developing or dying from cancer. For men, this is an astounding 50%. 1 out of 2 men will be diagnosed with cancer throughout their lifetime. And this is according to CDC statistics. For women, it's 1 out of 3. 33% will face a cancer diagnosis. There has been a significant investment of billions of dollars in treatment and research. But unfortunately, the improvement in mortality rate has been pretty low, only ranging from 2 to 3%. One of the main reasons for this is that current care provided does not take into account variation in lifestyle factors, such as nutrition, exercise, the impact of genes, and environmental toxins. Additionally, traditional treatment options often lack the specificity needed to address individual health needs and goals. The World Health Organization reports that tobacco use, obesity, alcohol consumption, low fruit and vegetable intake, and lack of physical activity contribute to around 1/3 of global cancer deaths. The good news is that between 30 and 50% of cancers can be prevented by avoiding these risk factors, implementing evidence-based prevention strategies, early detection, and appropriate comprehensive treatment. By detecting cancer early and providing timely, holistic cancer care, many cancers actually have a really high chance of cure. This reinforces the significance of continuous efforts in early detection and lifestyle management along with traditional treatments. We can learn a lot from history, so we delved into the past to examine the factors that have made a notable impact on reducing cancer mortality rates thus far. Turns out that over the years, several historical activities have contributed to improving the mortality rate related to cancer. Surprisingly, major progress in the decline of cancer deaths has been due to prevention and management thus far, not treatment. We have made significant advancements in the following areas. Screening. The implementation of widespread screening programs has played a crucial role in detecting cancer early, where treatments can be most effective. Mammography for breast cancer, pap smears and HPV testing for cervical cancer, colonoscopies for colon cancer, and PSA tests for prostate cancer are just examples of successful screening initiatives that have led to earlier detection and improved survival rates. Tobacco control. Recognizing the strong link between smoking and related cancers have led to efforts to reduce tobacco use. So public awareness campaigns, increased taxation on tobacco products, stricter marketing regulations, and smoking cessation programs have all contributed to a decline in smoking-related cancers. Nutrition and alcohol use. Adopting a healthy diet rich in fruits, vegetables, whole grains, lean proteins, and low in processed foods and sugary beverages has been associated with a lower risk of certain types of cancer. This type of diet is high in fiber, phytochemicals, and antioxidants, which all help fight cancer. Additionally, reducing alcohol consumption, and there's been a lot of new research come out recently related to alcohol consumption, linked to a decreased risk of several cancers, including breast, liver, colorectal, and head and neck cancers. And physical activity. Engaging in moderate to vigorous physical activity for at least 150 minutes per week can help maintain a healthy weight, improve immune function, and decrease inflammation, all of which, again, lower your cancer risk. And then lastly, sun protection. Public education campaigns have emphasized practicing sun safety measures, wearing sunscreen, protective clothing, and avoiding excessive sun exposure has helped reduce the incidence of skin cancer. Incorporating lifestyle factors into cancer treatment plans, much like they do with diabetes, heart disease, and dementia, can improve outcomes and significantly contribute to the overall well-being and healing of cancer patients. So what methods of cancer care exist currently? We want to gain an understanding of current cancer treatment modalities to see to identify the best opportunities where we can supplement some of the care. So two prominent methodologies exist. One is conventional, or referred to as standard of care, and the other is naturopathic or holistic medicine, which embraces holistic approaches to healing. In recent years, a third methodology, integrative oncology, has earned much merit and support. This innovative approach is underpinned by rigorous research and is showing remarkable promise in its ability to fulfill the overarching objectives of enhancing quality of life for cancer patients and reducing mortality rates. As we explore these three methodologies in greater detail, we'll look at their strengths and limitations. So we'll start with conventional standard of care. This is probably mostly what you've heard of mainstream when you think about cancer treatment. Conventional cancer care refers to the widely accepted medical practices used by oncologists and traditional health professionals. It involves treatments such as surgery, chemotherapy, immunotherapy, targeted therapies, hormone therapy, and radiation. These treatments are often approved by insurance providers and have been extensively studied. Their efficacy and safety have been established through rigorous clinical trials, thanks to sufficient funding that is available for this research. These treatments are often approved by insurance providers and have been extensively standard of care focuses on evidence-based practices developed by medical organizations and regulatory bodies. However, these treatments come with significant side effects, some which can severely interfere with quality of life. The outcomes achieved through these treatments are not optimal, and the financial burden imposed on patients and their families cannot be overlooked. The second methodology is holistic, functional, or naturopathic medicine. Holistic medicine approaches cancer care from a whole body perspective, emphasizing the body's innate ability to actually heal itself. It employs a range of complementary and alternative therapies, including nutritional supplements, mind-body techniques like meditation and yoga, dietary modifications, and lifestyle changes like stress management. While their safety and effectiveness vary, they offer a diverse set of therapies that have been utilized for centuries across the globe. Naturopathic medicine aims to support the body's natural healing mechanisms, reduce treatment side effects, and improve overall well-being. However, the evidence supporting the effectiveness of these interventions as standalone treatments is often unfunded and limited. Allow me to share a bit more about my personal experience on my cancer journey, highlighting how both conventional and holistic approaches played a significant role in helping me fight and overcome cancer. Following my diagnosis, I was scheduled for surgery and radioactive iodine, which required me to isolate myself for 2 weeks away from my husband and daughter. Undoubtedly, the most challenging part was missing some of my daughter's first moments. However, the joy and relief I experienced upon learning that the treatment had been successful made every sacrifice worthwhile. I was finally cancer-free. Yet, I still felt physically and emotionally drained. Medical professionals assured me that my fatigue was normal, urging me to have patience. After a year with debilitating fatigue, I continued to feel like a shadow of my former self. Determined to regain my love for life, I decided to seek the guidance of a functional medicine practitioner. Together, we conducted thorough tests and examined every angle of my lifestyle. With the focus on reducing inflammation and gradually rebuilding my body's strength through nutrition and natural supplements, we worked as a team. Over time, I began to experience positive changes and gradually regained my physical and mental energy. Completing cancer treatment was just one phase of my journey. My efforts to reclaim my sense of self and embrace a vibrant life allowed me to regain control and dispel the fear of recurrence. My experience serves as a testament to the importance of combining conventional and holistic approaches in cancer care. While conventional treatments target the cancer cell directly, holistic approaches address the overall well-being of the individual, promoting healing and restoration far beyond the physical aspect. By integrating both methodologies, I was able to overcome the disease while also rejuvenating my body and my spirit. The beauty of modern medicine is that we're not restricted to one philosophy because we actually have multiple effective options. Integrative oncology combines the best practices from conventional medicine with evidence-based complementary therapies to provide fully comprehensive cancer care. It recognizes the importance of addressing the physical, emotional, and psychosocial aspects of cancer treatment. The goal is to enhance treatment outcomes, improve quality of life, and minimize treatment side effects to support cancer patients and their families. Integrative oncology does not promote alternative therapies as a replacement for conventional treatments, but rather as supportive measures that can be integrated into any cancer care treatment plan. It emphasizes a patient-centered approach, tailoring treatments to individual needs and preferences, and fostering collaboration among all types of providers and practitioners to ensure the best possible outcomes. As the field of integrative oncology continues to evolve, ongoing research, clinical trials, and collaboration between conventional and naturopathic medicine practitioners are essential to further validate its efficacy and safety. This approach holds promise in expanding treatment options, improving patient experiences, and decreasing mortality rates. So what is integrative oncology exactly? It recognizes that cancer treatment should not solely focus on eradicating the disease, but to prevent it from coming back by addressing total health. Let's talk through some examples of protocols that integrative oncologists use as part of their cancer treatment. Low-dose chemotherapy involves administering chemotherapy drugs at a lower dose than traditional treatments. The goal is to minimize the toxic side effects while still effectively targeting and killing cancer cells. The goal is, this approach aims to strike a balance between treating the cancer and preserving the patient's quality of life. Lymphatic draining or massage involves gentle manipulation of the lymph nodes and lymphatic vessels to reduce swelling, eliminate toxins, and promote overall lymphatic system health. In cancer, lymphatic therapy may be used to manage lymphedema or swelling that can occur often after surgery or radiation therapy. Vitamin D, this is a simple one we can all do. We don't have to go to an integrative oncologist for this. It's used specifically during cancer treatment in certain doses to support the immune system, maintain bone health, and manage symptoms such as fatigue and muscle weakness, pretty much common side effects of any cancer treatment. The specific combination of treatments in integrative oncology varies depending on individual patient needs and preferences. The approach is often personalized and tailored to address the unique circumstances of each patient. So how can we help bridge the gaps with oncology navigation? The cancer team plays a pivotal role in bridging critical gaps in cancer care through nurse navigation. Our mission is to provide tailored assistance for patients and families, addressing their unique needs at various stages of their cancer journey. Here's an in-depth look at how we help at each stage. For those recently diagnosed with cancer, our nurse navigators serve as guiding lights. We empower patients to understand the information they receive, equipping them to ask informed questions and actively participate in their treatment decisions. We collaborate with the entire care team, ensuring seamless communication. Simultaneously, we help manage both mental and physical expectations, offering emotional support during this very charged time. We also facilitate discussions with family and caregivers, recognizing the importance of their involvement in the patient's care. For patients in the midst of treatment, our role evolves. We provide comprehensive education on the proposed treatment plans and the accompanying care strategies. Beyond this, we act as connectors for essential resources, helping patients access mental health services, transportation, childcare, or even assistance with daily essentials like meal planning. Administrative tasks such as scheduling and navigating insurance and documentation are also handled to alleviate the burden on patients. Post-treatment, our focus shifts towards empowering patients to maintain a healthy lifestyle. We guide them in establishing sustainable habits and embracing a wholesome life after cancer. This encompasses proper follow-up cancer care, nutrition, fitness, and mental wellness. A distinctive feature of our approach is family-centered support. From the outset, we involve central family members, friends, and caregivers in the patient's care plan. We proactively assess their needs and facilitate challenging conversations when necessary. Additionally, we provide resources that enable these support networks to assist the patient without compromising their own mental and physical well-being. In essence, our services are a vital thread in the fabric of cancer care. We aim not only to bridge gaps, but to create a supportive ecosystem that empowers patients and families through every phase of their care journey, ultimately fostering hope and resilience. The journey through cancer is a challenging one, but it's a journey that no one should undertake alone. The cancer team is here as a partner, an advocate, a support system. Together, we can face the challenges, embrace the opportunities, and work towards better health and brighter tomorrows. Please find us on social media and stay in touch by reaching out to me through our website or email anytime, whether it's a question or someone that just needs to talk through, even if our program's not appropriate for them. Thanks for your attention, and I look forward to hearing your thoughts and any feedback you have for me.